Lexington's first responders have a new team to rely on for more sensitive calls. In January, Lexington received a 3-year federal grant to establish a community crisis co-response team. The grant covers overtime for 45 police officers that have received specialized mental health training, and it also pays for the new mental health professional that is now on the team.
Responding with a full-time mental health professional directly to mental health calls with officers will help the focus of keeping people with mental health illnesses out of jail and in treatment or on the road to recovery.
City officials say that Lexington gets 3,000 mental health related emergency calls on average in a year. A report this year by the Community Safety Work Group showed similar programs are operating in more than 100 cities across America, including Louisville, which launched its program in 2022. We have the benefit of both of y'all also being Lexington lawmakers today. So, Senator Bledsoe, I'll start with you. What do you think are some of the pros and cons of having a program like this?
I think it's a very big positive. You know, Lexington police have always been leaders in crisis and intervention training, de-escalation, certainly in mental health. And this is a new 8-hour class that will allow some of them to just have more mindfulness when it comes to triggers and what may be indicators of mental health happening. You know, the policing is the first response is to get something safe, to get the environment and scene safe, and then do secondary help. Like if they need EMS, if they need extra sensitive training, or if there's a mental health crisis going on, they can best serve the people in that situation. So I'm all for it. I really applaud their efforts to provide comprehensive care and to really look out for the citizens and the community we have after getting sure everyone's safe and then looking for what we can do to help people.
Representative Stevenson, has there been any broader discussions around something like this occurring in Frankfort?
Well, not per se. I think a lot of us are watching what's been happening in Louisville with this program, and now we're excited to see this here. And so we're going to watch and see what happens there. Obviously, the money for Lexington came from a federal grant. So we're just going to watch and kind of see the outcomes and see what happens. But the General Assembly has been taking mental health much more seriously lately in the last few years, and we've done a lot to try to put our money where our mouth is, where we have talked about that. You know, just in July, we found out that the 988 emergency hotline has received almost 125,000 calls over the first 2 year period that it's been out, and that's a call about every 23 seconds. So we see that it's working. We see that we are able to offer help. There's a website, and oh my goodness, the name of it right now is escaping me, but it was launched for substance abuse, and they are now able to take mental health crisis on top of substance abuse calls, and so we think that that's going to get more help out there as well. So we're watching, and we are trying to find all of the ways that we can help.
Is there any thoughts about the safety factor of some of the situations that these responders may be put into? I mean, policing is a dangerous job, and we know that. If we put somebody that's more or less a civilian in those kinds of situations, is there reservations? Well,
I think that's right now, from the way I understand the system is going to work, is that they'll remain in the car while the officers who address the scene first make sure it's safe. And once safety has been provided for and there is less risk to the civilians, then they'll come out and engage. And that's really important. You know, that is the primary role of law enforcement, is safety. And so once that's there, then we really can address some of the mental health or other emergency needs that they have. And I think any law enforcement person across the state would like to have as much training as possible, just to make sure they're being wise and careful and providing good services.
Yeah, I think so too, and I think that this is a brilliant addition to the team. Our police officers are just like our teachers. Every year we seem to put more and more and more on them and ask them to wear more and more different hats. And so I think it's going to give them some comfort as well, knowing that they have a true mental health professional as backup once they secure the scene that can come in and help them, and that they're not going to be dealing with it alone, and that there's a professional there that knows a lot more about that mental health issue than they do.
All righty, thank you all both so much for your insight. We'll be right back after this.